necessary to have a talk tonight about menopause. Um, I will invite Sister Cynthia to come and open us with a prayer. And after her, you'll be hearing Sister Kathy and Sobersprath.
Good night to each and every one of you. I will ask you all to stand now. Our God and our Father who art in heaven, we thank you, God, for this day. We thank you, Father God, for your loving kindness and your tender mercies that has been extended to us another time. Father God, your word says to us, you wish that above all that we prosper and be in good health. So even as tonight, God, as we have come together, a bunch of women, oh Heavenly Father, and men also, I pray, Father God, that your blessings will be upon us. I thank you this day, Father God, for your journey and mercies. I ask, God, that all that we do here tonight, God, that it will be a way of edifying us, of building us up, and helping us, Father God, to really be encouraged. Oh, hallelujah. We know, Father God, that life comes with challenges, but we are so grateful, God, that you have given others the wisdom and the understanding, Father God, to help to guide us through this process. So I pray, God, that you'll be with us, you will strengthen us, and at the end of it, oh Heavenly Father, we will recognize that we are not alone and that you are still with us. You are still fighting for us. So, Father God, tonight, take all the glory and the honor that is due unto your name. Amen and amen.
This evening, I have the honor of introducing our speaker for tonight. She is no stranger to the Church of God at Mile and a Quarter. She's a daughter, a sister, a wife, and by a mom, and by profession, a doctor. So let's give a warm welcome to Dr. Renee Boyce, who will be presenting on the topic menopause. Congregation, Dr. Renee Boyce. Dr. Renee Boyce, welcome.
That gives you the opportunity to see me. This is a phenomenon that we see in the Church of God where the first 3 or 4 benches are always empty. So I am going to do what the school teachers would usually do. Come, students, come to the front. Come a little closer. Rest assured, I had a shower before I came here. Yes. Just waiting for my pointer. Tonight, I believe, has to happen. And the reason I believe that tonight has to happen is that too many things happened before I got here for me not to think that this session was important. I'm normally very punctual. First of all, I couldn't find the presentation. And then after I couldn't find the presentation, I finished getting ready. And yeah, it's on. Actually, the light's not on anymore, so I don't know if the battery is gone. See? And then, since I'm past 40, I got in our vehicle, driving down the road, and I realized I don't have my glasses. So back home, I had to go so that this presentation could go on. But menopause is something that we as women have to go through at one point in time or the other. When it happens, nobody knows. It's one of those things because as we will come to understand, it's actually a retrospective diagnosis, meaning that you can only diagnose menopause after you've gone through menopause. And the day that you go through menopause, the day after that, you're postmenopausal because it's after menopause. So we'll see as we go on. We will have time for questions. So note your questions down on whatever device that you have. Pen and paper. I'm still very archaic. I use pen and paper, but thank you so much. If you prefer to use your devices, you can also do it that way. All right, let's see. This, I am pressing left and right. Is it on? Okay, there we go. All right. Now, I'm going to have to read from here. As a matter of fact, I'm going to read from here. Either here or there. So y'all can still see me. I don't think anybody's being blocked. Is it okay if I stay here by the speaker? It's okay if I stay here? Okay. So what we're going to do is define what menopause is. There are certain terms that we use in discussing menopause. I believe that the basis of understanding menopause is understanding how hormones work. Of course, we're going to discuss the symptoms associated with menopause, and that discussion is more you than me, because I want to know what you know about menopause. And it doesn't make any sense me coming here talking about menopause and you go back through the door the same way that you came. So we're going to discuss how to manage these symptoms. And then there are some complications, or maybe not necessarily complications, but there are certain things that happen as a result of women going through menopause. And then there's the way that menopause is perceived by the society, what people think about menopause. And of course, like I said, we're going to be having those questions. It's not working. See, I'm pointing. Yeah. This is left. This is left or right. Oh, okay. Oh. All right, so what are hormones? I remember many, many years ago when I was in medical school, all right, can you go back? Back, yeah. Many, many years ago when I was in medical school, all right, I've turned it off. Do you have your pointer? Because you have your pointer there. You see what I tell you? Listen, no, but I know, but that's a bit. All right, so many, many years ago when I was in medical school, we were told that hormones are substances that are made in one part of the body, and they have their effect in another part of the body. So a classic example would be the thyroid hormones. The thyroid gland is a gland that sits here in the neck, and it sits in the neck, but the effects of the thyroid hormone are all over the body. So it affects your heart, it affects your digestive system, it affects your periods. So that's what a hormone is. Right on the bottom is this long, convoluted definition of what a hormone is, because science has to define things. But for our purposes here this evening, it's a chemical made in the body. It's made one place, and it has its effects somewhere else. So somebody, please tell me, what are the hormones that are associated with the ovaries? Estrogen, progesterone, testosterone. Right, so very often, do I have that up there? Very often people forget that testosterone is actually, even though it's dominantly a male hormone, females have testosterone as well. It's important in things like libido and part of our build as well. Next, please. All right, so just a few medical terms to understand. So menarche is the first menstrual period, and we are prepared for menarche. Little girls get the little pouch, you know, you get your sanitary napkin to put in it, extra underwear and tissue and wipes and everything. You get sent to school with that. Menstruation is what we know as periods. Regular periods every 28 days, and most people are not 28 days. It varies, 26, 27. There are so many different things that affect when your period comes, whether or not you're stressed, if you're studying, if you're ill. But generally speaking, if everything is well, it's once a month, unless you're menopausal, there is some underlying medical condition, or you're pregnant. Those are the only times when you do not have a period after you start having periods. And then, of course, there's menopause. The average age of menopause, they say, is around 51, 52, but this depends on the female herself. It depends on family. And then there's another phenomenon. I don't think, it might be on the slide after, but then there is perimenopause. Perimenopause is special. Perimenopause is special because it isn't menopause, but there are symptoms of menopause. And so it's difficult for women who are going through menopause to be sure that they're going through perimenopause and not going through menopause. And it's a very confusing time of life. And it's very confusing for medical professionals as well, because perimenopause can mimic so many medical conditions. So the question is this perimenopause, or is this something underlying that the female is going through? But tonight, we are dealing with menopause. So like I said initially, menopause is a retrospective diagnosis, meaning that you can only diagnose it after you've gone through menopause. And the medical definition is 12 months consecutively with no period. Today is the 4th of September, 2025. So let's say a female had her last period on August 31st, 2024. We go all the way up, nothing, nothing, nothing. And on September the 1st, she has a period. That's not menopause, right? That is not menopause, unfortunately. So we got to go another 12 months until there is no bleeding. And we're going to mention postmenopausal bleeding. If I don't mention it, please remind me. Next, please. All right, this slide here, what I want you to get from this slide is that so many different hormones are involved in a menstrual cycle. From when the egg is released from the ovary all the way down to when a woman bleeds. So many different hormones. And you can see that, like, let's take FSH, which is a hormone that comes from the brain. It starts out low. I need a pointer. It starts out low, and then it gets high mid-cycle, and then it goes low again. So there's a flux of hormones all the way through the menstrual cycle. And this is important because menopause is all about hormones. Next, please. So what's the purpose of the ovaries? All right, so the ovaries are where eggs are made. And like we said, like you all read from the slide earlier, ovaries make estrogen and progesterone. So they're important in women having their periods. What leads to menopause is when the ovaries start to shut down. So when we have that reduction in estrogen and progesterone, that is when the symptoms of menopause start to occur. Next. No, I don't think that was the next slide. All right. So what are the causes of menopause? So first off is the obvious thing, the normal, natural shutdown of the ovaries. That's the obvious thing. That is the first and the most likely cause for menopause. So as you get older, know that if you live long enough as a woman, I can't guarantee you much in life. I can't tell you anything about the economy. I can't help you with the weather, but I can guarantee you that you will go through menopause. Guaranteed. When? That is up to your genetics and your lifestyle, but you will go through menopause. So the best thing, I believe, is to be prepared for menopause. However, if you have to go through a surgical procedure, for example, some women have very heavy bleeding because of fibroids, or maybe they have a cancer in the uterus, and depending on the age, they might take out the ovaries at the same time. So if your ovaries are removed, that puts you in medical menopause, right? So you get the same symptoms, perhaps more suddenly than if you were going through menopause naturally. If you've been diagnosed with a malignancy and part of your treatment was chemotherapy or radiotherapy, then that's another reason that you could go through menopause. In some women who are younger, maybe in their 30s or 40s, for whatever reason, the ovaries just shut down and they stop producing the hormones that they're supposed to produce. And we call that primary ovarian insufficiency, meaning that the activity of the ovaries are not enough. The activity is not enough to do what the hormones from the ovaries are supposed to do. Autoimmune conditions, and what that means, the immune system in the body is supposed to protect you, but in some cases, the body fights against its own immune system. You've heard of things like lupus. That's an autoimmune disorder. Rheumatoid arthritis, autoimmune again. And in those conditions, we can also have menopause and general medical conditions. So if your thyroid is not functioning, they say that the pituitary is the master gland, responsible for everything in the body, but the thyroid is pretty much up there as well, because if your thyroid is not doing what it's supposed to do, your life is not going to be a happy one. All right, next. Oh my goodness me. Okay. All right, so this looks like a little super duper 20X, something really sophisticated, but I'm only supposed to press 2 spots. Okay. So, how would you know that you've reached menopause? So this is a discussion. I'm not going to be talking all night. All right, so that's one obvious way you stop having periods. And remember, it has to be 12 months with nothing, right? You start getting symptoms of menopause, right? And the other thing is you have to be in the appropriate age, right? So somebody who is 29 and has not had periods, she's either pregnant or she has primary ovarian insufficiency. Remember that one where the ovaries aren't functioning? So that means that there's some underlying medical condition that's preventing the ovaries from working as they should. So that's another reason why you might think that you have reached menopause. A little story. I was working in our government system, and a lady came in. She was 42. She was of Indian descent, and she came in and she looked very disturbed. And I asked her what was wrong, what she thought was wrong. She said she believes that she is going through menopause. I said, menopause? So she hadn't had a period for 3 months. And so as much as I could explain to her, I said, well, all women of childbearing age, according to the policies in the clinic, must have a pregnancy test, right? She said, sure, that's no problem. I'm going through the menopause. I said, okay. And so we did the pregnancy test, and I came back and I said to her, well, ma'am, you're not going through menopause. You're about 3 months pregnant. And she said, well, I'm going to confess, I was laughing so bad. I really was. I laughed. Because she was thinking that she was in menopause. I knew she was not in menopause, but she was disturbed because her son had just had his first child. So she was going to have a child pretty much the same age as her first grandchild, right? But I wasn't laughing out loud, I was laughing internally, right? So these are the reasons that you know that you have reached menopause. Are you in the right age? Do you have the symptoms? Have the 12 months passed? And have we ruled out that something else is not wrong? All right. If there is one slide that I want you to commit to memory, or at least understand, is this one. And the reason I want you to understand it is because understanding this helps you to understand menopause. All right? So what this shows, those of you who are nearsighted can actually take off your glasses. You might see it a little better. What this shows is the effects of estrogen. All right? Good. So from the top, we're going to spend about 2 minutes on this. Estrogen is responsible for breast development. So the pointer, this one, where's the pointer? It doesn't have a light? Oh, okay. So you can see in the top left-hand corner that it says breast. Can you see that? Yes. Okay, good. So that one says breast. It's responsible for the growth of the breast and breast development. The next one is the brain. Estrogen is responsible for body temperature. So it should be making sense now. If estrogen is responsible for body temperature, somebody can understand why we get hot flashes. Aha. It's also responsible for memory. Can I talk to somebody about memory in menopause? All right. It's also responsible, let me hear the men, for mood. For mood, right? We go down to the cardiovascular system now. If you think about it, not so much in recent years, but previously, when women died from heart attacks, it usually was a woman who was postmenopausal. We can't really say that nowadays because everybody dropping down. But usually it was older women because estrogen offers a protective effect on the heart in younger women, right? So once you don't have that estrogen, then you end up being predisposed to heart attacks. Estrogen is responsible for the lining of the uterus. It's responsible for the ovaries. And therefore, if the ovaries are not working properly, then periods start to give trouble. It's responsible for bone development, which is why women who are postmenopausal are susceptible or more likely to get fractures. And skin. If you look at it, I saw my 90... She's going to be 96 in October. She's 95. No, she's going to be 97 in October. She's 96. She has 3 teeth. As a matter of fact, she said it's 2.5 now. And she is what we would call pouncy. Oh, my goodness me. She is something special. So when I went to see her, she was wearing a vest, and she was wearing a house dress, and she had her arms up. Look, Dr. Boyce, look, look, look. All I got now is flaps, right? So estrogen is responsible for the subcutaneous tissue, right? Which is why the younger women tend to have this nice firm skin. And then older women have skin that tends to sag a little bit, which is why the cosmetic industry is making so much money, right? Because nobody wants flaps and saggy skin, right? So keep this in mind. All right, all right. Let's talk about the symptoms of menopause. You tell me, think. We called a couple of them already. Night flashes, anxiety, depression, palpitations, appetite suppression or excess appetite, joint pains. And there's one as women that we are worried about. No. Vaginal dryness, Itchy skin, weight gain, that is the one I was waiting for. Loss of hair. The reason I don't have hair is something completely different. It's not menopause, right? But that's another thing. Women come into the doctor because they recognize that my hair, which was previously luscious, it's gone. I got a big patch in the middle of my head. Doc, what's going on? My hair is thin, or I'm combing my hair and I'm seeing more on the floor than on my head. Right? So this could be a symptom of menopause. Any more symptoms you can think of? Yeah, we have irregular heartbeat, so palpitations. Any more? Fatigue. Decreased libido. Low sex drive, low or no? Yes, low or no sex drive. Okay, so remember, this is why I showed you that estrogen was responsible for breast development and growth and tissue. Because before menopause, we were parallel, but now it's perpendicular because the breasts have have fallen, okay? Right? It used to be nice and pert. Well, am I Whew. Am I right or am I right? I'm right. I am right, right? All right. Yes, right. So this pretty much. Oh yes, and the other thing with hair is that you end up getting facial hair and hair in places that you didn't have hair before. So the problem is that where hair should be, it isn't, and where it shouldn't be, it is. Right? That's just one of the problems of menopause. I want somebody to be brave enough to describe for those of us who have not experienced a hot flash what it feels like.
Boil water in a kettle. Sorry. Like if you boil water in a kettle and then somebody is directing the steam onto a particular area of your body, and it feels like it's coming from both internal and you're getting it internally and externally. And then it gives you, as Bajans would say, bad feels along with it. So you get not necessarily a nauseous feeling, but like faint, like upset stomach type of feeling. If that all comes together to make sense.
It does. It makes sense. Y'all agree? Right. And what you didn't mention was the sweating. Right? Right. So, and sometimes there's a feeling of anxiety and fear. This is how people describe the hot flashes. And previously they were called hot flushes because in fairer people, you can actually see the color change rising from the chest up to the face, where face turns red, but because we're dark, we really don't see it. And it became hot flashes because it comes all of a sudden, out of nowhere. And these hot flashes usually come before the start of menopause, so they start in perimenopause, and they can go on even after you've gone through menopause for 2 to 10 years. So, yeah. Right. Any other symptoms anybody else has felt or wished to, or everybody agrees with Nadia? All right, so she said obviously the change in mood can also lead to symptoms of depression. So, what happens? Remember, I told you that the brain was responsible for temperature control. The amazing thing about the body is that it tries to maintain a particular controlled state. So the body does not exist well outside of these parameters. Your pH is 7.35 to 7.45. Outside of those two things, you start to run into trouble. All right? Your body temperature, normal body temperature is 36.5, anything under 37 degrees Celsius. In your brain, there's a sensor. And when the temperature changes, this sensor is almost like a thermostat in the house. That's what it is, a thermostat. What happens during menopause, because estrogen isn't there to act as it should, this sensor misreads the information that's being sent to it. So it gets a signal that you are hot, and it tries to cool you down. And it tries to cool you down by making you sweat, by causing your heart to race, because it needs to get your temperature back to where it believes is normal. And until the effect of estrogen is completely gone and your brain understands, oh, well, estrogen isn't there anymore to regulate the temperature or to impact the way the temperature is controlled, you'll be getting hot flashes. All right. So we have a big problem with menopause. You have hot flashes, which are embarrassing, which are bothersome. You have weight gain, again, which is frustrating, and it can lead to depression or anxiety. With menopause itself comes anxiety and depression. And then you have the cousin to hot flashes, which is night sweats. So you're dripping wet at night, you can't sleep, you're frustrated, and then when you wake up, you're tired, and you already have fatigue. And then if you're married, you have a spouse, then you have issues with libido, no interest in sex, or even if you are interested, there are issues with, we're going to talk about the reproductive issues with menopause. Well, not reproductive, because there aren't any. The genital issues with menopause. So it's a period in your life when everything just seems not to be going right. And then this is usually the period of time where there's a transition. So you're usually around the age where your children are older and they're probably going to university, or maybe the children might have left the home. And then you're probably at that stage in your job where you have probably reached the highest level, so you carry responsibility at your workplace. And then there are persons who might want to change their job. So these are all the different things that are bothering you at this point in time. You have to finish paying off your mortgage. It's at that time the car is going to decide, well, you need to get a new Nissan Kicks. And then you have to be thinking about financial things. So this is the conundrum of menopause. So let's talk about the genitourinary syndrome of menopause. Remember, we had said that estrogen was responsible for the uterus, it's responsible for the ovaries, but estrogen is also responsible for vaginal secretions. It's responsible for the soft and supple nature of the walls of the vagina. So think of a lush garden and contrast that with a desert, because that's exactly what happens. So the symptoms of the genitourinary syndrome of menopause, and the name has changed, this is a new name. There's burning, there's dryness, and there's irritation. They're urinary symptoms. So you are here, you're sitting down, and you are fine. But then all of a sudden you need to get to the bathroom, and you're almost like an old person, because by the time you get there, or before you get there, the urine is coming down. Don't talk about if you sneeze, cough, or laugh too hard, right? So when we see the ads for the diapers, for the pull-ups, right? We can understand why, right? Because the panty shields are not enough if you get caught with a good joke, right? You gotta work those pelvic muscles, or you embarrass yourself. And of course, like I said, it's responsible for the vaginal lubrication. So if there's decreased lubrication, then there's pain, and then there's impaired function, and then there's frustration. And then frustration leads to depression, interpersonal conflict, and then mood disorders. So this is another big problem in menopause, where more than half, I think it's 63%. Yes, 63% of women are affected. It's more than half. So it's more than half the women in here who would have been, or who would be affected by genitourinary syndrome of menopause. All right, let's talk about menopause and weight gain. So of course, you know, it's the hormonal levels. Then, like I mentioned just now, it's that stressful period of life, so you have your cortisol levels going up. The eating habits, because of the responsibility that you have at work, for example, you don't eat properly, so you get the fastest thing to eat, or you're depressed and you're just eating because of what's bothering you mentally. Metabolism actually slows down with age. It doesn't matter. As you get older, everything slows down. It takes time to metabolize things as you get older. And of course, you might have some chronic illnesses, and therefore there are some medications that the side effects of these medications includes weight gain. And it is one of the biggest causes of distress after hot flashes in menopause, weight gain, the weight gain associated with menopause. So you were previously a 128, and then next time you step on the scale, you're seeing 163, and you want to know what happened? Menopause happened. That's what happened. But I will say menopause is not an excuse to be unhealthy. All right? So first of all, you have to manage your expectations, because remember I said we're going to discuss menopause and its symptoms, but I'm also going to help guide you through the process of managing menopause. So first thing you need to do is manage your expectations. If you weigh 160 pounds, newsflash, you weigh 160 pounds. The question is, what are you going to do about the 160 pounds? You should not exceed 2 pounds per week of weight loss. Anything faster than that is unhealthy. It is not advisable to try fad diets, like only eating grass, right? Because you set yourself up for failure. What you need to do is reduce your stress levels. I am biting my tongue, right? Because, right, we need to correct the sleep-wake cycle, right? And it's a bit difficult in menopause, obviously, because the hot flashes and the night sweats are keeping you up at night and so on. So these things we understand. However, scrolling at 2 o'clock in the morning and watching movies and so on at 2 o'clock in the morning is not doing anything to help your sleep-wake cycle. Adults don't understand that they need at least 8 hours of restorative sleep. Adults believe that they must do everything, and when 12 o'clock, fly in their bed, and because we live to the north of the island, you got to be out the house by 6:15, which means that if you have to get up and cook in the morning, you got to be out of your bed by 4:30. Right? It cannot be done. It cannot be done. That's not the way God created you to function. If you are having symptoms of menopause which are disruptive, do not suffer in silence. Don't stay home and suffer. Talk to your healthcare professional. There is one sitting right up front here. Right there. Talk to your healthcare professional. Get advice on, is there anything that it can take? And we'll discuss that a little later on. There's another type of diet that's going around. It is called intermittent fasting. And if we look at the pictures on Instagram and we see all the benefits of intermittent fasting, everybody wants to try intermittent fasting, but the question is, intermittent fasting for you? Is it healthy for you? Can you keep up with intermittent fasting? Is it benefiting you? The doctor-patient relationship, I think, after your relationship with God and family, is one of the most important relationships that you should have, right? People, unfortunately, think that, and I hear it all the time, oh, doctors just want your money. Okay. It's a business. Yes, we do need income, but we provide a service, right? Much of the suffering that people have is because they're not informed. And that's something that you can get from your healthcare provider, your pharmacist, the nurse that you see, doctors, psychiatrists. So you use the resources that are available to you. The use of anti-inflammatory foods, right? So there are foods which they've found are, I don't want to say that the food is anti-inflammatory, because that would not be correct technically. But for our purposes here, there are some foods they've found, like berries and cherries and the omega fats and those things that are anti-inflammatory, and they're good to include in your diet. Let's talk about good old exercise. How many persons in here exercise regularly? And by regularly, I mean at least 3 times a week. At least 3 times a week. So, when I say that 63% of the people experience genitourinary symptoms, right? That's more than half of the people in here. And less than 1/3 of the people in here exercise regularly. Why don't we exercise regularly? And notice I said we and not you. Tired. Okay. Do you know that if you were to exercise, you would have increased levels of energy and you would feel better? Mm-hmm. What's another reason for not exercising? Obligations. So let me tell you a little story. Well, it's not a little story. For me, it was profound. And this is, what time is it? 8:10. What time you started? 7:15? 45 minutes. Okay, yeah, we're gonna wrap up soon. Very quickly, I was working at the government institution again, and independently of each other, my pastor and my best friend, who's also the assistant pastor, independently of each other, they said to me, if you do not stop, we are going to lose you. And they didn't mean that I would stop going to church because of obligations at work. They meant that I was going to die. I had a manager who was like that man in the Bible who feared neither God nor man, right? And she looked at me and she said, you look tired and in need of rest. If she could tell me that I was tired, but I knew that I was in a very bad state. And I made the decision to resign because I have a husband and 2 children, right? And I would love to see my children grow up. So I resigned. I'm the type of person, if you haven't figured it out by now, I'm very detailed, very thorough. And so I wrote a handover list to make sure that the person who was going to be taking my place was not left, swinging, just there flapping in the wind. I handed in my resignation, let's say a Thursday, and my last day of work would have been a Tuesday. Wednesday morning, bright and early, somebody was in my chair. As irreplaceable as I thought I was, because I was efficient and I did my job excellently, somebody replaced me. There is no job in this country, right, that for which or from which you are indispensable, right? None, not one. I do not care if you are the CEO at the top or the maid at the bottom. And this is no disrespect to maid, right? Somebody who's a maid, but you get what I'm saying, right? It doesn't matter. There is no job. There is no job. All right. A word to the wise is sufficient. So these are some of the things that can happen as a result of menopause. So remember, estrogen is responsible for protecting the heart. So women after menopause are more likely to get heart attacks. They're more likely to get fractures. They're more likely to embarrass themselves by passing water. There is an increased risk of Alzheimer's. The question is, Alzheimer's occurs when you're getting older. So is it menopause or is it age? Not too sure. And there's reduced muscle power, right? Again, because of the lack of estrogen. All right, so how do we treat menopause? All right, so the problem is hormones. We don't have them. Replace them. That's an option. You can use creams for vaginal dryness. Now there are patches and gels and so on. There are sprays, I think. They're sprays, right? Not for estrogen, it's testosterone that has these sprays. Right, but estrogen has sprays now? There's a spray? Okay, I saw, the one I saw was testosterone, but by now, there must be an estrogen spray. Antidepressants, because we know that it comes with depression, but antidepressants have also been shown to improve the symptoms of the hot flashes. Vitamin D to strengthen your bones. Mr. Burroughs, listen to me, right? They need to do something with these tablets. So I decided, took it upon myself. I am 46. I said, I'm not going to wait until I'm vitamin D deficient. I am going to take vitamin D, right? The number of times I almost hanged myself on the tablets. These things are like horse pills, right? So that like 3 or 4 days passed before I went back at them again. This morning I tried again this morning and I said, no, Lord, no.
You have to charge.
I just said, go be liquid. I cut it in half. I'm there and I'm holding my throat and it was terrible.
There are vitamin D gummies that you can take.
Thank you. Anti-seizure medications as well have been found to not prevent hot flashes, but to help with the symptoms. All right. So we know all the bad press that the hormone replacement therapy has gotten. I was talking with a school friend of mine, and one of the things that has been discovered is that the doses might be the problem, that you don't start at that high recommended dose, but you can actually start at a lower dose and then build up to what's tolerable for the female. But it's effective for these symptoms there, the hot flashes, the night sweats, the mood swings, everybody, right? By replacing the hormones. But there are some risks, right? Breast cancer, blood clots, stroke. What happened was, you have to understand how studies are done. Studies, they take a group of persons, and it's supposed to be a group that's not biased, and they divide them in half, and you give a treatment, you don't give a treatment, and you follow those groups, and you see what happens. When hormone replacement therapy was first done, the group that was given the hormone replacement therapy was a group that was already predisposed to these things. So when the report came out that hormone replacement therapy causes breast cancer, blood clots, stroke, and whatever else, then hormone replacement therapy got a bad rap. No woman wanted to take hormone replacement therapy. When they reviewed the evidence, they realized that the study wasn't done properly, and that whilst there are women who are at risk for these things, the vast majority of women can take hormone replacement therapy safely. This goes back to the doctor-patient relationship, where you have that conversation with your doctor to determine your risk, determine what risk you are willing to take, which route you're willing to go in terms of managing the symptoms of menopause. Lifestyle changes. If the problem with hot flashes is being hot, do not wear to work a 3-piece suit. It makes sense. It makes sense. So you have to do practical things. You know where the fans are in church. Get to church early and choose the spot by the fan or the window. And this is one of the problems we have in the workplace, because some workplaces still require uniforms that in this hot Barbados are long sleeve jackets. And there was actually a lady who was reprimanded because so you see, this is why we need people who understand. Somebody was being, and I can use the Bajan term, this is Bajan, was being malicious. Saw the lady come to work with her jacket over her shoulder, and she came into the workplace with her jacket over her shoulder. It was before the place was opened for business. And went and complained to management that she came to work inappropriately dressed, right? And she simply said to the manager, I'm sorry, but I was feeling hot and unwell, and I came to work, and I was just going to take some time to, catch myself and then put on my jacket, and the place was not opened. If that person who was being unkind understood what menopause was, then there would not have been a complaint. If the manager had understood, if the manager knew better, then that complaint would not have gone anywhere, right? So it calls for understanding in the workplace, all right? If you do drink alcohol, it would be a good time to not drink so much alcohol. Well, hopefully nobody smokes. Kegel exercises are supposed to strengthen the floor of the pelvic muscle, so you try to do those to reduce the urine flow. And you can try lubricants over the counter, KY gel, and then there are so many other different brands that you can try. And you try to relax. So meditation is what you think about, right? Every time Christians hear meditation, they think that it is some witchcraft sort of something. Meditation is what you keep repeating in your mind. So if you, I think the psalmist David said, on your law do I do what? Meditate both day and night, right? Meditate is the verb, meditation is the noun from meditate, right? All right. So these are some of the lifestyle changes. Is there a menopause diet? Well, they followed 45,000 women in England, and they found that those people who had diets which were high in the omega fatty acids, the ones who were high in fruits and vegetables, essentially the healthy diet, were able to stave off the menopause symptoms for up to a year and a half. Those who had the ones that had the refined sugars and so on, they got their menopause symptoms earlier. So the long and short of the story is, if you want to delay menopause, eat healthily. If you want menopause to come and get it over and done with, well, eat, eat whatever you feel like eating. So these processed foods contribute to hormonal imbalances, contribute to inflammation in the body, and therefore they also contribute to insulin resistance. And this predisposes you to developing diabetes, and then there's also the risk of cancer, right? So processed foods are not good for you. Soy is another one of those things that got a bad rap. Soy mimics the action of estrogen in the body, and it's found in plants. And they found that soy has health benefits. But again, everything in moderation, right? Everything in moderation. I can go outside and I can eat the leaves from out there, right? And become a vegetarian. But I will eventually get sick, right? Because there are chemicals in the leaves out there, all right? So everything in moderation. And the benefits of soy are there. Healthy skin and hair. They improve bone density. It reduces the cancer risk. Remember, we were just talking about insulin resistance, so it does help with managing glucose control. And of course, because it acts like estrogen, it reduces the symptoms of menopause. And I'm pointing in this direction. Oopsie daisy. Right. Again, this is the same thing for dairy. Because of how foods are made now, they're additives. So they're saying that if you do have the option, you can switch to the organic option, which you know the implication is increased costs, right? We do. But when I say that, the question I always ask patients when it comes to the cost of health, just one question I ask: how much does a coffin cost? Right? That puts things in perspective for you, right? Well, even though you're not going to have to pay that cost, but you understand. Of course, caffeine. Caffeine is another one of those things. And remember, caffeine isn't only in coffee, it's in chocolate. Let's see the sweet tooth people in here. Caffeine, right? Confession is good for the soul. Confession is good for the soul. And many of the supplements that we take as well, the advice is that you read. I'm sure Mr. Burrows would tell you all this as well. Sorry, Mr. Burrows. But you read. In our country, they say that we have this high literacy rate, but we don't read often enough. Read the labels. Read the labels. So some of the supplements you might want to take do have caffeine in them. So be careful with the supplements. If you are buying an energy drink, 9 chances to 1, it has caffeine in it. All right? Herbal supplements. These are some of the supplements which science has found reduce the symptoms of menopause. And I have a cousin. He's brave. If he goes on the internet and he sees that there is something that is supposed to reduce something, he's going to buy it and try it, right? I, on the other hand, I'm very conservative, and I'm not going to try these things, right, until I do my research, and by research I mean thorough research. He has a suitcase, a small suitcase. I tell you the truth, I am in the Lord's house. He just went to look for his sister. He has a suitcase that has only supplements in it. Okay, I am surprised they have not held him at the airport for all these bottles that he has in his suitcase. So these are just some of the herbal supplements. But they say that vitamin C helps to reduce cortisol. Remember, cortisol is the stress hormone, and we're pretty stressed when it comes to menopause. Vitamin D and calcium, again, for that bone health. Because you're not sleeping because of the hot flashes and the constant fatigue, melatonin, memory issues, so ginkgo biloba. And we are now looking at bioidentical hormones. They're body-identical and bioidentical hormones, but there are compounds which are similar to the way that estrogen and progesterone act in the body. And I believe the bioidentical ones are the ones that are mixed up by different professionals and given in doses for the particular individual, as opposed to standard doses. And the bioidentical ones have not been studied as much as the body identical one. I might have the two mixed up, but that's the difference between the two. Just the social concerns of menopause. We spoke about that issue with menopause and work. And unfortunately, because of the symptoms of menopause, you tend to get some inefficiencies. But it goes all the way back, I believe, to understanding. There needs to be somebody in a workplace who can say, this is what it is. And it's not that derogatory, oh, she's going through menopause. That's not the way it should be. It should be more understanding, like, okay, this is a natural process. You are either having periods, perimenopausal, menopausal, or postmenopausal. In your organization, there is somebody which is represented in each of those groups. And the person who is currently menstruating is going to be menopausal at some point in time. So it calls for understanding, all right? So I called it, there are these employee assistance programs. I called it empathetic, aware, and proactive. So you realize that this person is in their 50s. Okay. Can you as an employer reduce their workload? Can you allow them to work remotely? Can you provide an area for them that's away from the sun coming in to the workplace? Can you allow them to wear a relaxed uniform? So these are some of the things that can be done in the workplace to help persons through the transition of menopause. Let us talk about menopause and men. I'm so sorry that there aren't any more men here, but this is real. Children, money, and sex are the three top causes for marital discord. If there is a problem, one of these three, two of the three, or all three are at the root of that problem. So we have understood that during menopause, there is decreased libido. There are mood swings. So you're okay now? I had a patient who said she was at work, and then all of a sudden she had to excuse herself because she burst into tears. Nobody said anything to her. She was not thinking about anything, but she just burst into tears, right? So the mood swings are real. Then there's also body shaming. You used to be a 32, 22, 48, and now you are a 48, 48, 48, right? So, it's difficult as a woman to know that I used to look this way, and now I'm looking this way. So I was just looking for the children. Intercourse requires more foreplay. It is not slam, bam, thank you, ma'am. Okay? No. Cannot work. It will not work. Remember, we discussed the we discussed the genitourinary syndrome of menopause, and we spoke about the decreased lubrication, the increased dryness, the burning and irritation. It needs work. The engine needs to be primed. This is not a license for infidelity. I have a patient. He is married. he has an outside woman. And he justifies the outside woman, saying that, you know, he and his wife, they're not physically intimate. So that's the purpose of the outside woman. Yes, he loves his wife. He respects her. His words. He respects her. He makes sure that she's provided for. But he has an outside woman. To this day, I cannot figure it out. Somebody help me understand. Because I can't figure it out. This is an opportunity to be creative and supportive. When I talk to teenagers, we go through the story of Mary and Joseph. And in the Bible, it says, and Joseph did not know Mary until after Jesus' birth. How long is a pregnancy? 9 months. Joseph was going without it for at least 9 months. Because then you still have to go with, after delivery, you got 6 weeks that they give you to catch yourself, right? Okay, it's possible. It is possible. I just wanted to mention, give some kudos to perimenopause. Occurs about 8 to 10 years before menopause. And perimenopause is a thing, right? So it's not the same as premature menopause, because this is where you're beginning to get that gradual early decline. The biggest problem is because for gynecologists especially, to say that you have a problem with your periods is that you start missing periods. But some women notice that the period is coming irregularly, or it's coming a little earlier, or maybe a little later, lasting longer. Maybe it's a little shorter. Maybe the flow is less, or maybe the flow is more. So they go to the doctor and they say nothing is wrong. The question that's asked is, are you having a period every month? Yes. How old are you? 41. Oh, you're too young. Nothing is wrong with you. But you're not too young. It's perimenopause, right? And it's something that's coming more in vogue now. People are really realizing that perimenopause is an issue, and the brain fog is real in perimenopause, right? So if only it was this easy, right? Shutting down. That's it. that's it. But unfortunately, this is not the way it goes. It's a process that we have to go through. So menopause is a natural consequence of aging. Like I said, if you live long enough, you're going to go through menopause. There might be some medical reasons why you might have symptoms of menopause, but generally speaking, it's due to the decline in ovarian function. Sometimes some people breeze through menopause. They have no idea that they went through menopause apart from the no periods. And other people have to be taken off of work because of the severity of their symptoms. Everybody's experience is different. Know that there are some complications that can occur as a result of menopause, like easy fracture of bones, heart attacks, and strokes, and so on. So always be in contact with your medical professional. And the treatment for menopause is multi-pronged. So you can take the traditional hormone replacement therapy. There are things that mimic the hormones that you can take, some of the supplements, that's the way they work, and lifestyle changes. But whichever route you go, lifestyle changes must be a part of menopause management. And it's a time when you need support. Some people are so stubborn and own way, and they don't like to ask for help. If you're having hot flashes, you can't be cleaning the house at 12 o'clock and you got 2 grown children in the house. No, cannot. Ask for some help. And you need an individualized care plan, because the symptoms of menopause that you have might not be the same symptoms that I have, or the degree to which the symptoms affect either of us. Please, please, I beg you, educate yourself from reputable sources, right? Not the forums where people give their mouth liberty to write anything that they feel like writing. And even if you see these things, you write them down or put them on your phone and you discuss them with your healthcare provider. There are some medical websites like Mayo Clinic and the Centers for Disease Control and the national health systems in the UK, where the language is simple to understand and you can get information from there. Take note of your symptoms. Please remember that not every menopause symptom is menopause, especially if you're not in the age for menopause. You must make sure that there is not an underlying diagnosis. And I wanted to talk about, lastly, postmenopausal bleeding. If you have had 12 months of no period, let's go back to our dates, today being September the 4th, 2025. Your last period was July the 9th, 2024. So you've cleared July the 9th, 2025. That's a year, 12 months. July, cleared August, and then you start bleeding in September, something is wrong. Something is wrong. Worse yet, if you start bleeding in 2026, right? You get my point. More than a year after the last period, something is wrong. Don't think, oh, my period has come back. No, it hasn't. No, it hasn't. The biggest risk is endometrial cancer, so you need to get that checked out. All right? So postmenopausal bleeding is a red flag. No pun intended. All right? And I believe that this is the end. Yes. Those are my references. Do you have any questions?
So if you have any questions, please raise your hand so that we can give you a microphone. Don't all go at one time.
Or have I answered all of your questions?
Brother Carl?
Yes, Lord. Good night.
Hi.
Now, I was always curious, madam, why there's a syllable men in front of menopause. Because when we were coming up, we used to make fun at it, and we would say when women put men on pause from sex. So is there a reason why the syllable men is in front of the word and not women a pause?
I am going to check one thing. Allow me to check something. I had a discussion with my son just today. He was asking me why something was named what it was named. So my question was, why do they call a car a car? Why is this called a bench? Somebody names something and it sticks. I'm trying to see if there is a root word in meno. That's all. That's what I'm looking for. Root word. Here we go. Yes. So it's called menopause because meno means month. Right? That's the root word. Meno. So it's pause of the monthly cycle. Month. Meno is month. So it's not M-E-N, it's M-E-N-O. Right. Any more questions?
Good night.
Hi.
Is it true that if a female starts her menstrual cycle very early, she goes through menopause very late? First question. And the other question is if going through menopause can affect your gums and teeth.
Okay, so the things that would impact when you go through menopause would more be genetics. So the same time your mother or aunts went through menopause would pretty much be the same time you go through menopause. My generation and the generation before me, these were things that weren't really discussed. So, I shouldn't say my generation, my mother's generation and my grandmother's generation, they're not going to have open discussions about menopause and menopause symptoms, right? It would have been hush-hush. So you have no idea that your mother or grandmother is going through menopause, right? So you don't know that that's the age. And when you go through menopause at a similar age, you wouldn't have known that it's genetics. It's not a rule that if you started, you had your first period at 8, that you're going to go through menopause at 60, right? Everybody is different. Everybody is different. And remember that lifestyle and all these things also do impact on when people go through menopause. And since I'm probably perimenopausal, what was the second question? Thank you.
Does menopause affect your teeth and gums?
Right, so menopause. Estrogen is responsible for the maintenance of tissues in the body, right? However, more than menopause affecting teeth and gums, it would be dental hygiene. There is loss of bone associated with menopause, right? So you can have issues with your teeth becoming loose because of loss of bone density in the gums and so on, right? So the answer to that, all of that is yes, it could be a problem as well. And this is the reason why you're supposed to interact with your healthcare professional, including the dentist. So if you notice that your teeth are becoming loose and shaky, don't just assume that this is menopause. Don't just assume, right? Pay your dentist a visit.
Good evening.
Boy.
Would heart palpitations be indicative? Would that give an indication as to if you would be prone to having cardiovascular issues through menopause?
Well, because hot flashes are what we call hot flashes are as a result of blood vessel changes, right? Blood vessel changes. We call them the vasoactive symptoms of menopause, meaning that it's blood vessel related. Rhythm, as in palpitations, would be something different. So it causes the production of different hormones that affect the rhythm of the heart, right? My take on it is, if you're having palpitations, don't assume that your palpitations are as a result of menopause, even if they come with menopause symptoms, because believe you me, cardiovascular symptoms would be palpitations, sweating, feeling unwell in your stomach. So the question is that a menopause symptom, or is that a cardiovascular or heart-related symptom that's saying something to you, right? Right, so you need to get it checked out. But you are prone, based on the fact that it is menopause, a reduction in estrogen, and you lose that effect. So remember I had said here, take note of your symptoms. So if your symptoms are happening along with the other symptoms that come along with the hot flash, then common things are common. So we would say, okay, your symptoms are as a result of that. But you should still have an ECG or a Holter and a workup like checking cholesterol and those things to assess your risk for cardiovascular events, right? So don't take it for granted. Any of the symptoms.
I don't have a question, Dr. Boyce, but the lady that was speaking about problems with teeth and so on, I know from experience you can have problems with your teeth due to kidney problems as well. Can cause you to have problems with calcium
And vitamin D.
deficiency, and can cause your
Vitamin D as well.
Right. So it can be the kidneys as well, not necessarily menopause or anything. So these are all symptoms.
I do have a question. You did mention that there are other circumstances where persons may experience menopause at an earlier age. So if it's there a case where you have an underlying health condition and you are induced or thrown into menopause prematurely, does that make these symptoms more severe, more frequent?
Well, I will say more shocking because you weren't looking for them. But yes, they would be a little more, I think a little more severe simply because menopause is a gradual decline. It's a natural process. When you're put into medical menopause, it is shut down, right? It's something that occurs suddenly, right? So the body has to take time again to, realign, adjust, that's the word I'm looking for. Has to take its time to adjust again, right? So the symptoms tend to be, and again, thank you for mentioning that. The experience of menopause is individualized, right? So some person can have a hot flash and be standing up there having a hot flash and talking to you and we still having a general conversation. Somebody else can have a hot flash and they need a bed to lay down in, right? So the experience is individualized. So even if the symptoms are brought on suddenly, somebody might be able to manage those symptoms better than somebody who's gone through the regular menopause. So it all depends on the individual. Well, not all, but to a certain extent, the individual experience. Right, so that was one of the first slides. How do I know I'm going through menopause? So the first thing would be, are you at the age for menopause? If you're not having any symptoms or your symptoms are not severe enough for you to know that you are going through menopause, that's all well and good. If you are not having a period and you are not pregnant and there's no underlying condition, then more than likely you're going through menopause. So even if you're not having hot flashes and vaginal dryness and mood swings, you're still going through menopause. You're probably one of the fortunate ones, whoever that is.
Good evening. Sister Kathy would have mentioned about at an early age. So I am forever 30, but today I'm 38.
Oh, okay.
And when I had my first son, I was 20. And then after he was born, there was a day I was at work and I got so hot. Mind you, the workplace was totally cold, like super, super cold. AC on, everything. And it became so hot. And I could fry an egg literally on my head. So I diagnosed myself with menopause at an early age. So then after that, after that, 10 years later, I had my other son. And all during the pregnancy, I was so hot. Like, you could have fried the egg then on my belly. And after that is like just hot flashes coming and hot flashes going. And I'm like, we're supposed to survive in this place. But it does start at an early age. I could be wrong. But like based off of all the notes you gave and the symptoms and the effects and the dryness and the moods and attitudes and my feet hurt as well too. Like from an early age, my feet was hurting. But we just out here surviving. But thank you for these services, this seminar, because it's really helpful because I believe that it happens at any age.
Right, so we can't call it menopause if it happens early. That's the first thing. The second thing is if you've gone through menopause, you can't have a second child. Right? Because menopause is complete cessation of the function of the ovaries. Right? Pregnancy itself is a whole hormonal thing, category, all by itself. Right? So, primary ovarian insufficiency, we spoke about that one where the ovaries start to shut down. Then perimenopause, 10 years or so before the actual menopause, right, where you start getting those symptoms. Hot flashes are real, the memory loss, that's real, the mood swings are real. And the patient that I told you about who left the office, she was in her 30s. She was in her 30s, and these are symptoms of menopause because she wasn't depressed clinically. No reason for her to be bursting into tears, right? So perimenopause. So it's more likely perimenopause than early menopause. Right. Any other questions?
Yes,
Sorry, my question is, apart from having a hysterectomy, a full hysterectomy, and you obviously are now into full menopause, you have nothing else, would other surgeries encourage the onset of menopause? Say like myomectomy that would cause a break in your menstrual cycle. Would surgeries like that encourage the early onset?
All right, so myomectomy is just removal of the fibroid tumors, and that doesn't interfere with the ovaries, which are the ones responsible for the hormones. If you have other underlying hormonal conditions, that would more cause the issues than a myomectomy. So interfering with the uterus for surgical purposes shouldn't, unless something went wrong with the ovaries at surgery, right? Because another thing that can happen, some people have endometriosis, and the endometrial deposits can affect the ovary. They can they can affect the ovaries, and if the ovaries aren't functioning well because of endometriosis, you can get symptoms of menopause.
Well, you've hit on all of my areas there because I have endometriosis. But all of these are things I find, just a point to note, all of these are things I find that people need to be more aware of. I'm sorry that we don't have a stronger male presence because this does not affect only the female. It affects everybody that she comes into contact with while she's going through the process. But I remember even for us as females, we spoke about it earlier that before things were so hush-hush, you can get certain conversations from your mother about certain things because, you know, we don't talk about those things.
Yeah.
We didn't even know what to call our private parts.
Correct.
And those type of things. So I find last year I was at a practice session when we had at James Street. I was at a practice session and the church was very, well, I thought that the church was really hot. And I started to feel really sick. And I started to beg for somebody to get one of the fans turned on. And somebody said menopause, and the lady said, "Oh, you was a baby. Well, you can't be going through menopause."
Same thing that the doctor said.
And I'm saying, but how are we labeling it like this? I said, but I'm not younger than 40. And I'm further away from 40, close to 50, that this should be something I would be expecting at this point. And the woman is still telling me, "Oh no, you're still a baby.
So
that shouldn't be happening."
This is why perimenopause is now being understood and why it's being discussed, right? Because you're prepared for menarche, the first period. You know that menopause is going to come, but I said be jinx in church. Oh shoot, I just said it. But seriously speaking, but nobody prepares you for perimenopause. Nobody prepares you for it, and it is real. It is real. So now that you are armed with the information, you can put persons like that, I don't want to say in their place, but you can correct them and let them know.
Yes.
Right?
And I will say it and encourage the younger women here, be aware of your body. This is not only for menopause, because coming along, I always used to be at a gynecologist because I have endometriosis. And they would always tell you have to know your body well so that when there are changes occurring, you can attack it head on first. And I remember I started having challenges with my hair. I never had problems with my hair before. And my hairdresser started to get concerned, and she would try different things, and we couldn't figure out what was going on till I realized that that's where I was heading. I missed all these signals. So we have to pay attention, which causes for be slowing down and looking after ourselves more, as you encourage. So we have to pay attention to our bodies and pay attention to what is going on within our lives.
Yeah, the same thing for breast examinations. right? Because if there are lumps, if you have generally lumpy breasts, but if another lump shows up to the party that you know is not part of the regular lumps, then that's cause for you to get to a doctor sooner rather than later. And we're finding that women are having different illnesses that previously only older women had. We're having them at younger ages. We're getting diagnosed with different things at younger ages. So it calls for being aware of your body and knowing yourself and your patterns. I always say to people, if my daughter stops eating, I'm going to accident and emergency. Risa is this big, right? This big. She's tall and slim. And if Risa stops eating, I know that she's very sick.
Good night. Like years ago, maybe years ago, or like no, people say you get pregnant during menopause. How was that?
Right, hold on. The patient I spoke about, she was young. What happens is because of the irregular periods that happen during perimenopause and menopause, women get lax and they think that all is well. All you need is one egg or one sperm. And this is how older women get caught, because they think, okay, yes, well, I got to be in menopause, so I free. And, well, no more periods, and I can do whatever I want. Oh, well. So I believe that everybody has asked their questions.
Just to address our online viewers, there were some queries that they had sent. Some of them you addressed.
Hi to the online people.
There were some areas that you did address, so I just wanted to mention their questions so that they would not feel forgotten. So some of the questions that were asked, some of the most common premenopause signs in women, some of the most unusual premenopause signs in women, the best natural medication recommended to assist women in their premenopause stage. Do women see the importance of educating men on menopause? And you addressed that in one of your slides. There was also an area asking how a husband can assist his wife during menopause, and also about making workplaces to be more educated as it relates to women going through menopause and being more sensitive. There is one question I don't think we fully addressed, which was, should women go to a special doctor who is experienced and has clear knowledge in the field of menopause versus going to a traditional family doctor?
Okay. To answer that, I'm going to try to be very diplomatic. I'm a family physician, and I think it has to do with the quality of your family physician. If you have a doctor whose interest is to get you in and out, you need another doctor. Because menopause is a time where you're going to need to sit down and talk, where you're going to need to be examined thoroughly. And most of it is emotional support. Yes, there are medical things that need to be done, but certainly you're going to need that emotional support, because remember, on one of the last slides that I had, there is that need for community and support. If you choose to go to a specialist, that's well within your rights as well. But one of the things that family physicians do and should do is to consult. So you don't necessarily have to go to, it would be a menopause specialist and so on, unless at the level of the family physician, you can't get managed properly, right? So you get referred, or the way it works is that you get referred if you're not being managed properly at primary care level. Because the healthcare system is primary care, secondary care, and then specialist or tertiary care, and then rehabilitation. So it goes down to personal choice. Nothing wrong with you going straight to your gynecologist and saying, look, I think I'm going through menopause and I need help. Or going to your family physician and sitting down and saying, boy, I think factory shutting down, talk to me, right? So the relationship is different, but, or it doesn't have to be different, because you can have that kind of relationship with your gynecologist as well.
you have ever heard of eating of yam. You know, you mentioned soy as something that mimics like estrogen. My gynecologist had told me at the time when I would have started to use hormone replacement therapy, he encouraged me to go natural and eat lots of yam. I don't know if you've ever heard that.
Well, I haven't specifically heard about yam, right? But there are many foods that have the properties of acting like estrogen, and that's essentially what it is. I will never eat yam. Yeah. This is one of the ones that I had mentioned. I'm sure that black cohosh is another horse pill, right? That's
Not that big. Okay, I have one question. What's your advice for wives who are going through menopause? What advice would you give them when they want to stop immediately from satisfying their husband?
okay. All right. I don't know. It's a reasonable question. It's a reasonable question. So I don't think it's an issue that she wants to stop satisfying her husband. I think it's an issue where she has to try to come to grips with what is going on with her, right? So the mood swings, the physical changes, the hot flashes, the fatigue, all of these are things. Put yourself in that position where you're experiencing all these things that you previously did not experience. And unfortunately, sex is not at the top of the list of things, even although you know that it is a priority in marriage, it is. But it really is not a priority at that point in time, because you have to understand every relationship goes through cycles, different changes, and it calls for communication. It's not like the shop shut or don't touch me. It calls for open conversation. Like, it's not that I don't want to have sex with you or whatever you else call it, whatever. It is just that right now I am not feeling in the mood, right? And it calls for patience. I think that's what it is. Patience and understanding more than anything else. Communication. And these are the things, illness, menopause, these are the things that show you what a relationship is built on. Because if, as a result of a lady going through menopause, putting on weight and not feeling happy about herself and not being in the mood, and you're ready to shut shop and pack up the marriage and go and find somebody else, then what was your relationship built on in the first place? Right?
Okay. It's 9 o'clock now. I'm going
Wow.
to take two more.
I was just going to say that.
Two more.
I'm off tomorrow, so.
I am off tomorrow too. I will take two more questions. Three, because I have one. And you said you're off?
Right. What I want to say is not ask a question, but I want to say that the question which Pastor Burrs asked, maybe that should be asked a bit different. What advice do you have for the men?
Yeah, it just boils down to patience and communication. That's it. Patience and communication. And understanding. Understanding. The age is, the average is 51, 52, but can be earlier or later.
I have the last year at 46 and it's 51 now.
Okay, right. Like I said, that's the average, right? But people sit outside average. They're either more than the average or less than the average. And again, it goes back to everybody's experience is different. different.
I have a response to Pastor Burrow's question.
Oh dear.
From my experience, it's not that you decide to stop. Sometimes the sensation just goes. I mean, not sometimes, it just goes. Literally, like, you don't want to be touched, you feel like your skin is crawling,
Yeah.
and you want to participate, like mentally, and in your heart you want to participate, but there's literally no sensation. None. That was my experience. My question for you, Dr. Boyce. So I started HRT in the UK, and I know that when you use estrogen, you need to have the progesterone to balance it. Now, if you decide to use phytoestrogens, is it necessary to have that progesterone replacement as well?
I believe so, because it has, I'm saying this under advisement, because I would have done pharmacology way back when. It's something that I'm going to look up to see if it's necessary, but I'm still thinking, even though it's phytoestrogens, which are supposed to be naturally occurring, if it's necessary or if it's only the commercially produced ones that require progesterone support. So I will look it up and I will get the message sent back to you.
Hi, my question is for the men that are here. Men do go through andropause.
See, that's another, no, what I'm saying is that there is supposedly a debate on whether or not that is true, right?
Oh. But my question to that is, the question before will be, what are the signs that women should look for in men? And the same way how we would like them to understand what we are going through, if we can understand what they would be going through, so we can know the signs and try to help where we can.
All right, so andropause is a decline in testosterone levels in men, which again is another age-related thing, because eventually testosterone levels will fall. You know, in your 20s, that's when there's the peak of testosterone, when you're going through puberty, and then peaking in the 20s and a gradual decline. Testosterone is responsible for the manness of men, right? So their muscular build, right? The virility, you know, that maleness, their urge to do things, and of course the sex drive as well, and their body composition. So you find they're saying that the men who are going through andropause, they tend to have increasing abdominal girth, like a bigger belly, as opposed to that lean muscular physique, because they decrease in. I'm just telling you what it says. Right, and also the decreased libido, but the problem is that goal, get it, you know, going after things, that virility, that drive is what disappears with the decrease in testosterone. So if you have a spouse, a husband, who is going through andropause, then it comes with affirming him, letting him know that, you know, I am so grateful for what you're doing, you know, for providing for the family, you know, for being faithful. And so these are the things that you look for, right? That the male becomes less male. And then with that can come depression and the same moodiness that women have. Men can have that as well. They can become withdrawn, because men tend not to say what's bothering them. We as women, we will talk and talk. Some women will talk and talk and talk, and they will say, you know, we'll say whatever is bothering us, but then they internalize their fears. You know, am I able to provide? I've lost my job. You know, they keep these things in and they become sullen and withdrawn. So you have to look out for those things as well. Okay. So let me say thank you. Thank you for the opportunity to share with you. I hope that I've given you sufficient information to go back home and to put into perspective your own symptoms, whether you are perimenopausal or menopausal or even postmenopausal. And not only this information being told to you is for you, but the other females in your life who are having challenges managing the symptoms of menopause. Apart from community support, that relationship with your healthcare provider, I think, is paramount to assist you with going through this. And of course, the community of sisters in the church. When you're sick and you have a cold, if I have a cold now and somebody calls me and they give me a good joke or whatever, I still got the same cold, I still got the same amount of virus in my body, but I feel better simply because somebody has called and lifted my spirits. And it's the same thing for managing menopause, right? The hot flashes got me with my personal fan, and I am upset. I'm not managing at work and whatever else, but somebody comes along. Somebody. That was not intentional. Actually, as I closed my mouth, I did a talk and I introduced some ladies to my friend Perry. Tall, dark, and handsome. Doesn't ask you any questions. He doesn't ask anything of you. He knows when to shut up, when to stay silent. And the next thing I showed was a picture of a personal fan. Right? That was Perry. It was a talk on perimenopause, right? So we understand the need for the personal fan. But thank you all very much, and it was great being here again.
Good night again. I want to thank Sister Renee Boyce again for coming and speak to us. She has an open invitation for us. And I would like to thank you very much. I would like to also thank the online viewers. Thank you for being here with us. And right, I'd like to thank you, all you women and gentlemen who take the time to come out this evening. I want to thank you. I also want to take this time to invite you ladies to our women's ministry. Our upcoming ministry is going to be on the 14th. Right, the 14th, right? The 14th, and we are doing a back to school special, and you're all invited. You can put on your back to school colors, and you can come and have a lovely evening with the women at the Minor Quarter, and it's at 5. Right. I would also like to thank the media team. Thank you very much. Brianna and Hendricks, I would like to thank you very much. And I would like to thank Pastor Burrows and anyone else who